Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics with my lovely wife, Dr. Christine, who is also a dentist. And we're going to be talking about a very important topic today, and that is gum recession. Okay, so first off, what the heck is gum recession?
Yes, so gum recession is when your gums or your gingiva starts to pull away from your teeth and your root surfaces start to be exposed. So, you know, that yellow stuff under that's kind of porous, that's your root surface. And so it becomes really sensitive there.
That's right. I think because it's so much more porous than your enamel, all the stuff can get through and it gets really, really sensitive. I kind of have that on one of my teeth and it gets sensitive at parts. So that is gum recession.
Plus the nerve endings are exposed there.
All right, that's right. So that is why your teeth get a little more sensitive, because that cementum or that root structure is a little bit more porous than the enamel. So how the heck do you get gum recession in the first place? Let's go through a couple reasons why you may have gum recession. All right, number one is probably poor oral hygiene. So what is poor oral hygiene? You know, sometimes you get this plaque or tartar / calculus that's stuck in your teeth, and I want to explain the difference between the two. So the tartar that's stuck on your teeth, or the calculus, that's the really, really tough stuff that you cannot get off by yourself at home. You need to come in and see one of us or see the dental hygienist, and they're going to scrape it off for you. Whereas plaque is that stuff that's kind of like foamy and kind of has this weird kind of texture on your teeth, but you can actually get that off yourself. If you're using an amazing toothbrush like the Thrive toothbrush or Sonicare toothbrush, you can get that stuff off yourself. So what happens if you don't get that off and you have all this calculus build up or this tartar build up, and it just gets more and more and more and more? What happens is that bacteria goes and actually gets in between the teeth and the gums and starts to make this very, very, very inflamed, and it's actually going to make the tissue pull away from the tooth. And if that goes on for a long enough time, it's actually going to pull, and eventually you're going to start to see the roots of your teeth. So the moral of the story is, if you need a deep cleaning or if you need a cleaning at all, you should get it done before those roots start to show, because that tartar and the plaque build up.
And also it leads to bone loss too, right? If that plaque and tartar is building up and it's not being properly removed, it's a chronic infection that's going on in your mouth, which affects the rest of your health too. So yeah, it's not just because it looks bad that we don't want you to, deal with gum recession, but because it leads to really, really bad consequences to your health. So the next cause of gum recession is brushing way too hard or just excessively. So never ever brush with a hard bristle toothbrush, because that actually damages the enamel and can damage your gums as well. And if you're brushing way too hard with too much pressure, it causes for the gums, which are extremely delicate, to start pulling back, which is why we start to see the gums recede. So always, always use very, very gentle pressure. If you're using an electric toothbrush, let the brush do the work for you, and just hold it with very, very light pressure, holding that toothbrush at a 45-degree angle along the gum line, okay?
Isn't it interesting that our teeth, enamel is the strongest substance in your body, but the gums, not so much. That's why when you're brushing, you're probably not gonna hurt the teeth as much, but if you're brushing too hard, you're definitely gonna hurt those gums. So don't brush too hard. All right, another reason you may be having some gum recession is clenching and grinding. We know that life can be very stressful sometimes, but if you're clenching and grinding, what happens is the tooth actually kind of flexes near the gum line. And if it keeps doing that, the enamel and the cementum start to chip off, and it actually erodes the gums away from the teeth. So either you're clenching or grinding during the day, or maybe clenching and grinding at night. So here's the two solutions for you. If you're clenching and grinding during the day, basically you just need to start learning and realizing that you're doing that, and try to train your mind not to clench and grind. That's step number one. If you're stressed, try not to clench and grind down. If you're doing it at night, yes, it's more difficult to wake up in the middle of the night and stop clenching. That doesn't really happen. So a night guard is a great option for you. That may not necessarily stop you from clenching and grinding, but at least it's going to protect your teeth. So if it's happening during the day, try to stop it. If it happens at night, probably need a night guard, and that's going to help protect your teeth. The next cause of gum recession is near and dear to my heart, because I'm an orthodontist, and that is crooked teeth. Okay, so this is what happens. Sometimes people have teeth that are sticking out too far, especially on the bottom. We call that a crossbite. And what happens is you have all this excessive force being pushed on those lower front teeth, and they constantly push them forward and forward and forward. And then what happens is all that gum and tooth structure that's there gets damaged, and the gum eventually recedes away from the tooth. And if it gets bad enough, the teeth become really mobile. And if it gets worse than that, the teeth actually need to be taken out, and it's only because the teeth were in the wrong place. So how do you fix that? If you're in the Dallas-Fort Worth area, you come into our office, we give you a free consult. Hopefully you get some braces or Invisalign to make those teeth nice and straight. And that is the easiest way. Or if you're in a different city, just go see your orthodontist, get those teeth nice and straight, because straight teeth is not just for looks, although it is nice, it's absolutely for function as well.
Yeah, and hygiene.
Okay, so now they know all about recession, but what the heck? What's the problem with having recession?
The problem with gum recession is that now that the gums are receded, they're kind of pulled back already and they don't grow back. So once it's gone, it's gone. And so we can't grow it back unless you have some sort of gingival graft surgery or periodontal gum surgery. Also now it's more sensitive, and so you're always gonna have that sensitivity every time you eat anything cold, it's there. And then now you're at a higher risk for getting cavities because, like we said, it's more porous. That surface is weaker than the enamel. So decay and all kinds of issues can happen to those exposed areas. And then also another issue with gum recession is that it leads to tooth mobility or even tooth loss eventually, because as the gums recede away, so does the ligaments and eventually the bone as well. And so the tooth is no longer supported.
Okay, so you may be saying, okay, Dr. Nate, Christine, I have gum recession. What the heck do I do? Okay, step number one. If you are sensitive, an easy kind of fix that I do sometimes is use a toothpaste called SENSODYNE, and that will help the sensitivity that you get because the root is showing and is more porous. So that's step number one. Step number two, if it is more severe than just that, quite a bit of the root is showing, you may need to see your dentist or a dental specialist, which we call a periodontist, and they can do some different gum grafts or different surgeries to help bring that gum back, because like you said, once you lose it, it's gonzo. It's not coming back unless you do a gum surgery to help bring that gum back. Number three, I would say, well, if you have this, you might already be too far beyond this, but prevention is key, right? So if you're coming in for your 6-month cleanings, if you need a deep cleaning, you need to get those things done, because once the gum is gone, like we mentioned, it's not coming back, and it's really quite a bit more expensive, quite a bit more time consuming to fix the problem once they've already occurred. The best way to fix this is to never get it in the first place. So come in for your regular cleanings, make sure you're brushing and flossing to keep those teeth beautiful, nice and clean, and those gums, gently, and keep those gums very, very nice and clean, because prevention is absolutely key. All right, so now you know what gum recession is. You know that it's your gums leaving or moving away from your teeth, but we're not done here. We're not done here. You are probably wondering now, what is the difference between a deep cleaning and a healthy mouth cleaning or a prophy cleaning? So you can click the video above here, and that is going to give you the best, most informed answer to that question. And we cannot wait to see you guys in the next video.